Hi everyone, my name is Osaid Alser and I'm presenting this on behalf of our Oxford University Hand Surgery Outcome Research Group. The title of my presentation is Serious Complication and Risk of Reoperation Following Dupuytren Disease Surgery. And this is a population-based cohort study of 120,000 patients from England. I have no disclosures. So the objectives of our study are to estimate the risk of serious local and systemic complications as well as reoperations after Dupuytren disease surgery in England. And we queried the hospital episode statistics database, which is the largest inpatient database in England, to include all patients, adult patients who underwent Dupuytren disease surgery in England between April 27 and March 2017. And we used two study designs. The first one is a longitudinal cohort study, and the second one is called self-controlled case series analysis, which is essentially a method to adjust for all time fixed confounders. So we included around 500,000 adult patients who underwent 158,119 operations for Dupuytren disease. When we looked at the local complication rate within 90 days, the rate was low at 1.2%. With regards to systemic complication within 90 days, the rate was also low at 0.78%. Now, we also did a sub-analysis looking at the 90-day amputation rates, and these were generally low at less than 1%. However, amputation following reoperation by limited fascectomy following dermofascectomy was high at 8%. And when we looked at the incidence rate ratio of postoperative systemic complications following the Dupuytren disease surgery compared to the preoperative baseline risk using the self-controlled case series analysis, we can see that there is an increased risk of AKI as well as MI, especially after operations routinely performed under general or regional anesthesia, and these include limited fascectomy and dermofascectomy. And finally, this is a Kaplan-Meier curve, and it shows the rate of reoperation following Dupuytren disease surgery, and we can see the rates are generally low compared to previous reports described in the literature. We can also see that limited fascectomy and dermofascectomy had similar reoperation rate, and this is likely represent the recurrence rate. And we can also see the rate is lower than less invasive procedures such as PNF or percutaneous needle fasciotomy. So in summary, the Dupuytren disease surgery performed in England was generally safe. However, reoperation by limited fascectomy following dermofascectomy carries a high risk of amputation. Although serious systemic complications were rare, the data suggests that high-risk patients should probably undergo treatment under local anesthesia, and that includes Welland type of anesthesia. We hope this data would better inform shared decision-making between providers and patients with Dupuytren disease. Thank you so much.